Should I worry if I have a pancreatic cyst? Discovering a pancreatic cyst can feel unsettling, but it's important to understand what it really means. Pancreatic cysts are fluid-filled sacs that develop on or inside the pancreas, an organ located behind the stomach that helps with digestion and blood sugar regulation. Many people find out they have a cyst during imaging tests like a CORT scan or MRI done for other health reasons. The good news is that most pancreatic cysts are benign, meaning they are not cancerous, and often do not cause any symptoms at all. There are different types of pancreatic cysts. Some are non-neoplastic, which means they are not tumor-like, such as pseudocysts that usually develop after pancreatitis, an inflammation of the pancreas. Others are neoplastic, meaning they have the potential to develop into tumors. The most common neoplastic cysts include serous cystadenomas, which are usually benign, and mucinous cystic neoplasms or intraductal papillary mucinous neoplasms, which can sometimes become cancerous over time. While most of these cysts are harmless, some, especially mucinous types, need careful monitoring because they can progress to pancreatic cancer if left unchecked. Most pancreatic cysts do not cause symptoms. When they do, it might be because they grow large enough to press on nearby organs or block the pancreatic or bile ducts. Symptoms can include abdominal pain, nausea, vomiting, weight loss, or a feeling of fullness after eating. Risk factors for developing cysts include a history of pancreatitis, certain inherited conditions, and getting older. If you have these risk factors, your doctor might watch your cysts more closely. Diagnosis involves imaging tests like computed tomography scans, magnetic resonance imaging, or endoscopic ultrasound. Sometimes, doctors take a small sample of fluid from the cyst to analyze for signs of cancer. The decision to monitor or treat depends on the cyst's size, appearance, growth rate, and whether it has features that suggest a higher risk of becoming cancerous. If your cyst is small, less than 2 centimeters, and shows no suspicious features, your doctor might recommend regular monitoring with imaging tests. Larger cysts over 3 centimeters, those with solid parts, or cysts causing symptoms may need closer observation or even surgical removal. Surgery is considered when the risk of cancer is higher, but it is a major procedure and is only recommended when the benefits outweigh the risks. It's important to remember that while some cysts can develop into pancreatic cancer, most do not. Certain types like intraductal papillary mucinous neoplasms and mucinous cystic neoplasms have a potential to turn into cancer if not properly managed. That's why ongoing monitoring is essential, especially for cysts with high-risk features. Your healthcare provider will help determine the best plan based on your specific situation. If you have been diagnosed with a pancreatic cyst, the most important step is to stay in close contact with a healthcare professional who specializes in pancreas health. They can help identify what type of cyst you have, assess your personal risk, and recommend a tailored plan for follow-up or treatment. Do not ignore the cyst, but also do not jump to conclusions about cancer. With proper medical care, most people with pancreatic cysts can maintain good health and avoid serious complications. In summary, most pancreatic cysts are benign and do not require immediate treatment. Some may have the potential to become cancerous, so regular checkups and appropriate monitoring are key. Always seek personalized advice from your doctor, as individual risk factors and cyst characteristics vary. Remember, early detection and careful follow-up are your best tools for protecting your pancreas health. If you have concerns about a pancreatic cyst, talking to a healthcare professional is the safest way to get accurate information and peace of mind.